Give medications directly into the feeding tube. Never add them to the feeding bag or mix medications with the tube feeding formula, breast milk, or with each other. A liquid medication is easiest, otherwise your pills will have to be crushed using a pill crusher. Some medication, marked SR for sustained release, are not meant to be crushed. All medications should be mixed with water so they will be easier to insert into the feeding tube. If more than one medication is needed, always flush the feeding tube with water between each medication. Always shut off the feeding pump to give the medication. Some feedings may interfere with the medication. Flush after the medication with the recommended amount of water and restart the feeding. To give a medication, start by gathering your supplies, including 1. Medication, 2. Flushing syringe, 3. Water for flushing tubing after medications, 4. Feeding tube extension set if needed, 5. A pill crusher if needed. Follow the steps for gastric feeding. Wash your hands. Position upright. 1. For pump feeding, stop the feeding and open the G-tube button or feeding tube port. If needed, attach the feeding extension set to the G button. Hold the button firmly and open the safety plug or cap. Line up the black marks on the end of the extension set with the marks on the feeding cap. Insert the feeding set. Turn clockwise to lock, about a 3/4 turn. Check to make sure the feeding set is secure. 2. Draw up the water in the syringe. Attach the syringe to the feeding extension or feeding port of a gastrostomy or jejunostomy tube. 3. Unclamp the tubing and flush with the water in the syringe. 4. Reclamp and remove the syringe. 5. Pour the required dose of the medication into a medicine cup. 6. Draw the accurate dose of medication into a syringe. 7. Use a second medicine cup to mix the medication with water. Mix medications with 30 milliliters for an adult and 5 to 10 milliliters for a child unless fluids are restricted. 8. Draw the medication mixed with water back up into the syringe. 9. Attach the syringe to the feeding extension set or feeding tube, unclamp, and deliver the medication. 10. Clamp and remove the syringe. 11. Flush with water after each medication using the same steps. 12. If you have a G button, remove the feeding extension set and close the plug or safety cap at the end of the button after medication delivery. Okay, now it's your turn. If you have a skill kit, gather your supplies and practice giving a feeding through a syringe and giving medication.